Hello everybody, hi, I'm Jewel and welcome. Welcome to my channel. First of all, I hope all of you are doing well, that you have absolutely everything that you need while you are staying in place, that you have your medicines, you have enough food, and of course you are healthy and your children and family is healthy. So guys, today I want to read you a statement from the National Kidney Foundation that is talking about the vaccines within the kidney community. So guys, let's get started. Statement on kidney patient prioritization for COVID-19 vaccines and therapeutics. The National Kidney Foundation, NKF, representing more than 37 million adults in the U.S. with kidney disease, their families, and the professionals who care for them, believe that a key principle of ethical vaccine allocation must be that the vaccine is made available to patients at a higher risk of severe outcomes from COVID-19 infection. Accordingly, we urge the federal government to prioritize kidney patients and kidney care professionals, along with residents of long-term care facilities and healthcare workers in receiving access to COVID-19 vaccines to reduce the increased risk of severe morbidity and mortality caused by the novel coronavirus. The federal government must prioritize the development of an infrastructure to support the COVID-19 vaccine to kidney patients. Over 500,000 people in the U.S. rely on life-saving dialysis to replace kidney function. Almost 90% of these patients dialyze in facilities where dialysis is performed 3 times a week for 4 hours at each time. While dialysis facilities are a practical site for vulnerable kidney patients to be vaccinated, facilities may not have the supplies to safely store the vaccine. It is vital that dialysis facilities, among other sites where kidney patients receive care, have the support and supplies needed to expeditiously implement priority vaccine practices. COVID-19 and its impact on kidney patients. Given the relative risk of kidney patients to severe COVID-19 infection and outcomes, NKF calls on the federal government to prioritize kidney patients and their caregivers in their COVID-19 vaccine distribution plans and to work with states to ensure prompt vaccine distribution to kidney patients. Among kidney patients, we recommend prioritization based on relative risk for poor COVID-19 outcomes using the following approach. Consider dialysis patients and staff, home dialysis patients, transplant patients, immune suppressed kidney disease patients, CKD patients, patients with glomerular disease, autoimmune disorders, and etc. Other CKD patients, individuals living in the same household as kidney patients. Vaccine safety and efficacy. NKF appreciates the efforts of the administration, specifically the leadership of the Department of Health and Human Services, HHS, the Food and Drug Administration, the National Institute of Health, researchers, and vaccine manufacturers to ensure that vaccine candidates meet rigorous standards for safety and efficacy. As several vaccine candidates were developed from research conducted on previous coronavirus, evidence about safety and efficacy is very promising. It is worth noting, however, that few of the vaccine candidates were widely tested in individuals with kidney disease or transplant recipients. NKF calls on policymakers, vaccine manufacturers, and developers to carefully monitor and collect data on vaccine safety and efficacy among kidney patients to ensure patient safety and to inform future vaccine development. Vaccine hesitancy. The burdens of kidney disease and COVID-19 disproportionately on Black or African American and Hispanic or Latino communities. Recent survey data from COVID-19 Collaborative Langer Research Undias USA and NACP identified low levels of trust in the COVID-19 vaccine among Black or African American and Hispanic or Latino people, though particularly among Black or African American adults, only 14% of whom completely or mostly trust that a vaccine will be safe. NKF recommends that federal, state, and local policymakers follow the recommendations of public health leaders of color on how to best encourage vaccine uptakes in these communities. Okay, guys, as you see, the National Kidney Foundation has called on the government to make sure that kidney patients are not lost in this vaccine allocation. Of course, as you have known, that there's been a very, very high rate of COVID-19 and in the kidney communities, and it has done a lot of damage, of course. And so the National Kidney Foundation wants to make sure that the kidney community is not forgotten, plus their caregivers, healthcare workers, and everyone that deals in the kidney community. And in the statement about the people of color, black people, African Americans, whatever you call yourself. There's a problem with this vaccine because a lack of trust, which comes from history, which means that a lot of black people in the 30s and 40s were experimented on, through the medical community, and so it left a lot of mistrust in the black community about things like vaccines and other things that they want to they want to do in black communities. So it is up to, of course, the black doctors and NAACP and all those that deals with the black community to let them know how safe this vaccine is, because otherwise they were going to have an issue. Because, like I said, black people in this country were experimented on, in the medical community for really things that were, very, very bad, and it caused a lot of mistrust. So, guys, this is interesting article. That means that, and also this article tells that kidney patients and transplant patients were not a part of this. Were not a part of this. Um, um, this vaccine, and so the kidney community is not very happy about that, because they think that we are, a kidney community, CKD patients are the higher risk patients right now during this COVID-19, and they should have been included, so they are making sure that nobody is forgotten in this community, and they want to make sure that everybody knows that, you need to make sure that we are included, in this allocation of vaccines. So, guys, this is Statement on Kidney Patients Prioritization for COVID-19 Vaccines and Therapeutics. Okay, guys, if you found this article useful in any way, please like, share, and subscribe. And as always, always sending all of you so much love and affection, especially the CKD community, because, like I said, we have been ravaged by this disease of COVID-19, this virus, and they are basically trying to find the best solution for us in this virus. And of course, they need the data to make sure that, when we take this vaccine, that it will be safe for all of us in the kidney community. So, guys, like I said, I send you love, affection, and so much more. And as you see, there's so many the so many of us and so many people that are fighting for our community to make sure we are safe during this rollout of these vaccines. So, guys, take care of yourselves, and I will see you on the next video.